Have you ever wondered why you go to the bathroom more often than friends? Or maybe you already know. Maybe you've seen someone and been diagnosed with overactive bladder, and today you're just looking for more information. But either way, stay tuned because today we talk about overactive bladder. What is it, and what can you do about it? So we'll start off talking about what is OAB. So OAB stands for overactive bladder. And there actually is a definition. So overactive bladder is simply symptoms of frequent urination, urgent urination, or rushing to get to the bathroom. Urinary frequency means that you're going to the bathroom at least 8 or more times in a 24-hour period. There's a special kind of urinary frequency that we call nocturia. That's getting up 2 or more times at night. So what causes overactive bladder? Well, the honest answer is we don't know. There are some things that can irritate the bladder, so too much caffeine or acidic foods and beverages, maybe even artificial sweeteners. But it's not quite accurate to say that those cause overactive bladder because they don't really cause the same kind of irritation in everyone. How do we diagnose overactive bladder? Well, here's some good news. The fact is, in order to diagnose overactive bladder, it doesn't require expensive tests or invasive procedures or anything like that. Most people can be diagnosed with overactive bladder simply based on their symptoms. So patients who urinate frequently, urinate urgently, or rush to get to the bathroom and can't make it, that don't have another underlying cause, we call that situation overactive bladder or OAB. Now, there are some bladder warning signs that we should be mindful of. And if you have any of these warning signs, it's probably a good idea to see a bladder health specialist before concluding that you have overactive bladder. Some of these warning signs include blood in your urine that you can see or that's seen under a microscope, a history of pelvic surgery or pelvic radiation, or difficulty urinating or difficulty emptying your bladder, called urinary retention. So when I see a patient in the clinic, what do I recommend for overactive bladder? Well, the first thing that we usually do, what are often called first-line therapies or behavioral therapies, is we look at some of the things that someone can do on their own in order to decrease the symptoms of overactive bladder. The good news is you don't have to see a medical provider to follow this advice. You can watch this video or some of the other videos that we have, or even go to the website and get more information. One of the first behavioral modifications I usually recommend to my patients is fluid moderation. Now, it's really important that we understand that fluid moderation is not the same thing as fluid restriction. In fact, fluid restriction can lead to constipation, which can actually make the symptoms of overactive bladder even worse. In terms of fluid moderation, what I'm really talking about is making sure that we're making about 1,200 to 1,800 milliliters of urine per 24 hours. How do you find that out? Well, a really good way is to complete a diary. I actually have a copy of one on the website. So go there, download it, and complete it, and you can kind of get an idea about how much urine you're making in a 24-hour period. A second technique for behavioral therapy is bladder training. So yes, you actually can train your bladder. A really good way is to take a look at the diary that you completed and get an idea about how much time in between urgent episodes do you have. Maybe it's an hour, maybe it's an hour and a half, maybe it's 2 hours. But whatever that time is, subtract a little bit. So let's say that I look at my diary and I'm urinating about every 2 hours. And when I'm going, it's very urgently. I would subtract back from that. And so every hour and a half, I would urinate on a schedule. Now, you don't need to wake yourself up at night for this, but during the daytime, you would start off by urinating every hour and a half. It might be different for you. The idea is that very gradually, you're increasing the interval of time when you urinate. And so that over time, you may go from urinating every hour and a half to every 2 hours to every 3 hours. For most patients with overactive bladder, I generally wouldn't recommend you going with an interval that's longer than every 3 to 4 hours. The last technique of first-line or behavioral therapies are pelvic floor exercises. Pelvic floor exercises, often called Kegel exercises, are a technique in which we tighten the muscles that help us to maintain continence. And that can do a couple of things. Number one, it can keep you from leaking. So if you have an urgency episodes when you're rushing to get to the bathroom, doing a pelvic floor contraction at that time can actually help you from leaking urine. But another thing that pelvic floor exercises can do is that if you have an urgency episode, doing a pelvic floor contraction can actually decrease the urgency. So for instance, when we talk about timed voiding, if you're urinating every hour and a half, but after 45 minutes you have an urge to go, you can do a pelvic floor contraction and suppress that urge. Now, this was just an overview of behavioral therapies for overactive bladder. You can go to our website where I have detailed information about each of these therapies, including frequently asked questions, or stay tuned for future videos where we'll talk about each of these behavioral therapies in depth, including specifically what foods you might want to avoid, how to moderate your fluid intake, how exactly can you do timed voiding, and how do we do pelvic floor exercises. In addition, other videos will talk about medications for overactive bladder much more specifically, and then eventually we'll also talk about so-called advanced therapies for OAB. There's a lot more information if that's the kind of depth that you want.